Wonderful. So, hi everyone, welcome. We are very excited that you are able to join us today for this webinar about adapting your advocacy in light of the pandemic and the COVID-19 or coronavirus health crisis that we're currently facing. This webinar comes from a variety of conversations, actually, that Evita, who you'll meet in just a moment, and myself, conversations that we've had recently with a lot of our Watershed partners about the challenges that people are facing related to their advocacy. But what is extremely promising from our perspective is the flexibility and adaptation to advocacy that everyone has made at district, national, and global level. And so we're very excited to hear case studies or information about what's happening, but also to hear from all of you. So Evita, do you want to go to the next slide? So there's a couple of kind of housekeeping items for making sure we have a successful webinar experience. I think everyone at this point is probably very aware of what it's like to be in an online meeting if you worked before this global crisis, that lots and lots of meetings have turned to online. So please mute yourself and turn off your camera, except when you're speaking. And we have a chat box. And so feel free to write in any questions, any feedback that you have, any ideas, any ways that you've been adapting, all of the comments and information that you can provide to us, I think the better. And we'll be sharing information later. We wanted you to note that this is being recorded so that your colleagues or anyone else can refer back to this or can listen at a later point in time. Unfortunately, we don't have the ability to do any translation, but we hope that everyone will be able to listen and type in any questions. If you have responses that you'd like to make, there are French speakers and Spanish speakers and others on, so feel free to write those things, but this will all be conducted in English. And then for those who have just joined, please enter into the chat box your name, the organization you're with, and where you're located at the moment, so which country you're in, so that we have an idea of who is on the call. And for those that are part of Watershed and the Watershed program, you know what Watershed is, but we have a large number of folks who are joining us from outside one of the organizations that's a partner of Watershed. So I just wanted to say welcome to all of you, and we're really excited that everyone has been joining. So Evita, next slide. So I just wanted to go over quickly the objectives of the webinar. We want to take this opportunity to really discuss through the chat and when we have time at the end of the webinar, and learn from each other about ways that we're able to adapt our advocacy during this time, the practical examples of what that means at national and local levels, and then to really think about ways that we can reach our target audiences, despite the fact that we're in this space of social distancing, and how to adapt messages, keeping Watershed priorities or whatever the priorities are of your organization at the moment, but keeping in mind that this needs to be through the lens of COVID-19 or coronavirus. Next slide. So our outline today, we have 3 different presentations. We have scene setting from Evita, who's from IRC. We have and 2 country experiences, one from Bangladesh and one from Kenya. And we have Ranjan Kumar Ghosh from WaterAid in Bangladesh who is the work package lead and leads all of the watershed work in Bangladesh. And then we have Patrick Wanzia from Samadhi in Kenya. And Patrick is also the lead for the work for Watershed in Kenya. So we have a lot of time at the end for both clarification and questions and answers for the panelists, but also to have a broader discussion. So we're very excited to have everyone here. And at this point, I'm going to turn over to Evita to continue on with her presentation. And I'm going to turn my microphone and my video off, but I will be monitoring the chat and we'll try to respond to folks along the way. So Evita, over to you. Thank you so much. Evita, you're muted.
That was great. I just had my first slide without you hearing what I was saying. No,
yeah.
I'm kidding. I was, no, thank you. I was thanking you everyone for joining, because when Ellen and I were working on this more overarching introductory presentation on behalf of the learning trajectory and policy influencing, we were discussing that we might have ideas about the opportunities and challenges, but we are very keen to hear your thoughts and insights. So I want to start with asking all of you who are joining to, if you have any thoughts that appear or experiences, just leave them in the chat box and then we can pick them up after the presentation. So why is strong advocacy essential during a crisis as we're currently facing? Or why is advocacy essential during any other crisis, whether it's a political crisis or a natural disaster, or basically in a time of massive global inequalities? In these sort of times, the role of civil society
Evita?
You muted yourself again.
Evita, you need to unmute.
Oh, yeah. I am sorry why that's happening. All right, let me start again with, so even beyond a global health crisis as we are currently facing, the role of civil society is essential to find effective solutions for poverty and injustice, to influence high-level decision makers, and also to ensure the human right to freedom and freedom of expression and opinion, to ensure those inclusive budgets and policy making. And also right now in COVID-19, to ensure that national and local governments include a WASH health response in their emergency. So before getting into the challenges and opportunities, I would like to talk first a little bit about the very basic definitions that we run into when talking about advocacy. And I'm certain that you're all familiar with these, but I just want to talk about them real quick. So what do we talk about when we speak about advocacy? It is a wide range of activities that are conducted to influencing decision makers at levels to combat the structural causes of poverty and injustice. So also to ensure the human rights to freedom of expression and opinion. Tactics, the means to achieve the advocacy goal and objectives such as lobbying, campaigns, policy papers, reports, manifests, etc. And for those that are more familiar, remember the spectrum or the continuum that we showed within Watershed. On the one hand side, you have the more activist approach with public campaigns, and on the other hand, you have more the policy papers. Those are different tactics of which you can use to achieve your advocacy goal. Different ways that civil society can use these tactics are to, one, organize and mobilize constituencies, to raise awareness, to shape public opinion, and to engage with decision makers to influence key policies. And then final, we have the advocacy strategies. This is a document supported by this process to identify advocacy goals, objectives, activities, and messages to address policy and budget problems. All the different Watershed work packages now have their own advocacy strategy, And as you're familiar with, you worked on it in a long process where you identified 10 different steps from the issue to the objectives to different tactics that you can use to address these issues. And I'll come back to the advocacy strategy later on. So what are those direct effects or basically challenges that COVID-19 is giving, we're faced with? First, the pre-pandemic messaging may no longer be appropriate or appear insensitive. Basically, I'm saying here that, or Ellen and I are saying here that the messages that you identified earlier, or that I've identified within the Netherlands work package on advocacy, are no longer appropriate. For example, we in 2021 in the Netherlands, we have the elections in parliament, and we were going to ask an increase of ODA budget. Now we need to think of our narrative as the Netherlands also facing, and the rest of the world are facing, a severe economic recession. Secondly, a shift in political focus to deal with the crisis may not align with your original advocacy objectives. For example, you might ask the specific policy officer to implement systemic long-term WASH solutions, and now this specific person is more focused on short-run emergency support. There's NGOs and CSOs are facing physical restrictions, which make lobby, advocacy, and other awareness-raising activities challenging. I think this is straightforward as we're all working from home, or most of us, doing our direct lobby, which are overall face-to-face meetings and interactions, and it makes it very challenging. Fourth, in places where there are less restrictions on movements, for example, in rural areas, individuals delivering key hygiene messages can be in danger of contracting COVID-19. It is really important to emphasize here that when we're doing our campaigns and awareness raising, we must make sure that when reaching those left behind, that we also do no harm to ourselves, but also to the people that are there, and that we need to maintain physical distancing. And fifth, high-level decision-making is happening quickly and often without consultation of civil society, which is understandable in a pandemic, but it can have consequences for marginalized populations. So basically right now, also in the Netherlands, a lot of decisions are made very fast, but then civil society, someone mutes him or herself. I'm receiving a lot of feedback. So thank you. So, excuse me. So basically make sure that when high-level decisions are made, that civil society is consulted. However, COVID-19 is also offering us some sort of opportunities in terms of advocacy. And you have most probably seen a lot of news articles where WASH is mentioned as the first line of defense until we find a proper vaccine in the coming year or 2 years. And WASH is also an integral part of the health response. This is also referred to in literature as, of course, it's as a policy window, a window of opportunity. And therefore, I would like to emphasize that in advocacy now, in these times, you need to be opportunistic and make use of these opportunities that arise. For example, here I showing here a Dutch news article, which is saying that the Dutch Minister for Foreign Development Cooperation is saying we need to act now to prevent a silent disaster in sub-Saharan Africa. And honestly, this was one of the very first time since she became a minister that she actually mentioned WASH or hand washing during one of her public appearances. So this is a policy window that we could make use of. In literature, something which also occurred to me is that they're saying that actually a crisis could make sure that the policymakers are more receptive to us as WASH experts. We're more receptive for advice and comments. But so far, I'm a bit doubtful about this piece in literature, and I would be very keen to hear your experiences so far. If you see that for you, it's easier to get at the table or to speak with your policy officers, or if they reach out to you for support. Now, after highlighting the challenges, but also some of the opportunities, I would like to go in very quickly into different roles that civil society and NGOs can play during this health crisis. First, as yesterday also announced by the Secretary General of the United Nations, there is a lot of fake news, which is putting lives at risk. This is also something I've mentioned here in the Netherlands, but also when I was traveling in Sri Lanka, that there are a lot of counter narratives in social media. And therefore, the role of civil society would be first, the promotion of accurate information and awareness raising for good WASH practices among citizens, government officials, and all other stakeholders, while maintaining social distancing, which is a challenge. Secondly, the role of CSOs are advising and holding national and local governments accountable on policies and legislation by using the available accountability mechanisms. So also holding governments accountable to the new legislations that they or policies they are working on now in their emergency response. And my third point is on supporting and seeking partnerships with CSOs, NGOs, and media and holding governments accountable. As mentioned by Civicus earlier, the space for civil society is shrinking, but even is shrinking in a more fast pace due to these physical restrictions. And therefore, also Civicus is asking to protect our co-workers during COVID-19. And also, fourth, ensuring no one is left behind in long-term systemic solutions, and long-term systemic solutions are in place for the most marginalized in emergency response. This is, I think, a very interesting story on the right-hand side of what's happening now in Burkina. And I'm not sure if Arnaud is online, but he might want to tell a bit more about this. Is that currently the rural people in Burkina are left behind in the emergency response of the president. And on the left-hand side, you see a very interesting article about Sierra Leone, where they're emphasizing that a society is only as strong as its most vulnerable members. I'll leave it for now. I now want to give the floor back to Ellen, and I would very much like to hear from you in the chat box or later on if there are any other first opportunities that you might have identified, challenges, or other roles that come to mind when talking about advocacy in the chat in COVID-19. Thank you.
Great. Thank you so much, Evita. I think this was great to provide background. And as Evita said, I think it's really wonderful to hear from all of you. Also, additional challenges that you might be facing in regard to how COVID-19 or the coronavirus has really affected your advocacy. There were two interesting points that came up, one from Sarah from Samavi, who was talking about not only are those delivering the messages at risk of contracting coronavirus, but also they may be the ones bringing coronavirus. So I think that there's a lot of challenges around message delivery and other things, but also around civil society and other key stakeholders being left behind in the high-level decision-making processes. And that was a comment by Patrick Wanzia, who we're going to hear from shortly. So continue to use the chat box to share stories, to share information about what you're doing. And I'd like to turn over now to Ranjan to talk about what the Watershed team is doing and how they've adapted in Bangladesh. So Ranjan, if you want to unmute yourself, and then whenever you want to advance a slide, just let Evita know and she'll do that for you. So Ranjan, if you want to unmute yourself, the floor is yours. Ranjan, if you're there, I think you're still muted. Let's just check. Ranjan, we're having difficulty hearing you. Let's just see. Ranjan, we're still having difficulty hearing you. What I'm going to suggest, if it's okay, Ranjan, if you want to try to leave and come back, we'll have Patrick present first, and then we'll come back to you. So, Ranjan, why don't you try to rejoin the meeting one more time, and we'll turn over right now to Patrick Wanzia. To have him present, and then we'll come back, Ranjan, to you to present after Patrick. So Patrick, can you unmute yourself, and let's hope that we can hear you. Patrick, are you there?
Yes, I'm here.
Wonderful. Patrick, why don't you go ahead?
Thank you, Ellen, for the
Thanks.
opportunity to present the Kenya experiences on adapting our lobby and advocacy strategies in view of COVID-19 pandemic. So, yeah. Okay, let's go to the next slide. Yeah, this is an overview of the pandemic, COVID-19 pandemic in Kenya. We received our first case on 13th of March, and to date we have 216 confirmed cases with 9 deaths, and overall we have about over 2,000 contacts that have been monitored with 1729 discharged, and about 600 being followed by the Ministry of Health. Out of 47 counties, we have 19 of them which have been affected. These include the watershed focus areas, that is Kajiado and Laikipia. And we have curfew no-go zones, either entry or exit from Nairobi, Mombasa, Kilifi, and Kwale counties. Let's go to the next slide. Now, in response to restriction of movements, social distancing, to adapt different ways of working.
Patrick, sorry to interrupt. If you want to turn your video off, then I think maybe that will save some of the bandwidth, and it might be easier to hear you.
Yeah.
Great, thank you. Yeah. Okay, go ahead. Sorry to interrupt.
Yes. So we have a number of adaptations that we have done so far. And the first one is on the Watershed, a radio interactive show, whereby we are trying to engage with the citizens in Kajiado County to get their views on a number of issues, one being access to water. And this time of COVID-19 is very key on how they are getting water for personal hygiene. The other question is around social inclusivity, that is participation in decision-making processes, budget allocations, priorities, and also challenges they get to access water. So these are the 4 questions that are running between April to June. And we'll be able to get to analyze the data that is coming from the people. And we normally have 2 radio stations that are hearing these questions out to the citizen, and they respond with a free SMS. And then we'll be able to analyze this. And we have technical support from your Track FM in Uganda. Actually, this is the work being scaled from the EWASA work, which was done last year and was shared with us in India. And we are scaling it here in Kenya. So we hope by June we'll be able to use this evidence that we get from the ground and engage the duty bearers on issues around WASH in Kajiado County. we have already started the exercise, and we believe we'll get a lot of feedback from the citizens in Kajiado County. Next. Again, in line with the inability to move to different parts of the country and also to associate or to meet, we've been able to apply a number of online communication tools. And of course, this includes mobile phone calling and Zoom, use of Zoom tool, WhatsApp calls, and teleconferencing for engagement with both internally within Watershed partners and also externally with the government departments and the CSOs involved. Actually, now we are now planning to go even lower to the grassroots level to have a Zoom session with the citizens. And we are starting with one of the focus areas in Laikipia County, where we need to engage them and get some issues affecting them around COVID-19. And of course, we are going to look at with a WASH lens, but of course, we're going to be very much open to other issues affecting them. So this, once we get this, we aim to do a lobby messaging memorandum to the government to highlight or to upscale the voice of the people on the ground on the issues affecting them as we try to fight or to prevent COVID-19 spread, which is a WASH agenda because of the hand washing and the personal hygiene, which requires water and proper sanitation. I also want to note that the first time we tried to use teleconferencing, we failed in Kajiado. And because the tool that we were trying to use with the local network provider here could not enable one of our partners near in Kajiado to call more than 6 people. So that kind of a teleconference backfired, but we are trying to redo the same this week using a Zoom tool. So we continue trying to look for other effective online communication tools. And we are open to suggestions from other colleagues who have tried others. And yesterday we were given opportunity to explore life size. And I think I've given the contacts there for our partners internally here to explore whether it is a good thing to use or we can also get others. So we are making much of the online communication tools to reach out to the different actors and stakeholders, both the government, duty bearers, and the citizens and other CSOs. Next. We have also found that from the national level to the county level, we have what we call emergency response committees. There's one at the national level, and there are also some being formed at the county level. This is where the first decision-making processes are taking place about COVID-19, and we also try to align ourselves with this kind of mechanism where decisions are being made. And as Evita have said, if we are not careful, you can find ourselves CSOs getting left behind in this decision if you don't find your space there or you have a way to hear your views to those committees where decisions are being made. And to this respect, for example, we have made good progress in Kajiado County, where our partner NIA has been given mandate to convene all the CSOs involved in WASH and WRM to discuss and raise their lobby issues that we can be able to channel through NIA to the Kajiado County Emergency Response Committee, where decisions are being made at the county level, affecting the whole county. And we believe it is there where we can be able to raise issues on human rights to water and sanitation. Even during the times of crisis like this, they should be respected, they should be enhanced. Social inclusivity, that is participation by both the citizens and also the CSOs in issues affecting them and the issues affecting the vulnerable groups. So at least in Kajiado, we have one of us. And also I have confirmed this morning, we have a CSO that has been identified based in Kajiado, who are also going to be sitting at the higher level to get all the views from the CSOs, from the WASH sector, from the health sector, to be able to present them at a higher level. So at least in Kajiado, we have a structured way that we can have our views reaching to the top level decision-making body. And we are planning to follow up the same structure and make ourselves able to reach the higher level in Laikipia County. Next. Early this year, where the Office of the Attorney General in Kenya sent out invitation for inputs from different stakeholders because the COVID-19 struck in the country and we didn't have rules and regulation to moderate the processes. And we happened to get this very fast. Within 2 days, we were required to give a feedback, and we sat as Watershed partners in Kenya, of course, led by KWASNet and myself also. And then we tried to bring our ideas together, and we responded with a memorandum with inputs from both CSOs within the Watershed and the other networks to the Attorney General on what we want to see happening in these rules. And two of the key things that we tried to capture in the memorandum was respect for human rights. Even during the times of COVID-19 crisis, human rights to access to water, to sanitation, to information, to participation in decision-making processes. So we have said, even during this time when the decisions are being made very fast, we need to see those human rights being respected. And two, we also raised the issue of sectoral coordination, whereby the line departments or the line ministries like the Public Health, Ministry for Water and Sanitation, and the other line ministries being able to work together from the national level to the county level, so that they will be able to address the COVID-19 pandemic issues, which are also WASH-related, in a very coordinated manner. And these are the forum where we say we also want to have an access through CSOs. Then one of the other point I'd like to note is during the times of crisis, duty bearers or the decision makers can usually get open-minded and can be open to other views from other stakeholders. This is what we tried to use in Kenya when that invitation came on board. And then lastly, we have now planning to do a watershed messaging response to COVID-19. And we are going to have a forum where we are going to be sitting to discuss what are those specific issues we need to be communicating either to Laikipia County or to Kajiado County or the national level, so that we have all speak from the same voice, we speak from the same understanding, and we identify the issue we want to focus on, especially the WASH-related, without forgetting social inclusivity and the human rights aspects. So I think once we get that, again, now we'll be able to have proper messaging because we've been trying to get the plans from different committees, both in the two regions, what they are planning to do to address the COVID-19. And with that, we'll be able to get the issues, the lobby and advocacy issues that we think we can engage with. So that's where we are now. Thank you very much for the opportunity to share our experiences.
Great. Thank you so much, Patrick. That was really, really great and useful information. And I think the response and how quickly you guys have been able to adapt and the processes that you outlined, I think are really great and hopefully give people some ideas. If you have other ways that you're adapting the work that you're doing, those of you on the call, please feel free to add those to the chat box. There are some questions that I saw for Patrick, but we're going to hold all questions to the discussion timeframe to make sure that we get the presentations down and we leave enough time for discussion. So I'm going to turn now. So Patrick, if you want to go ahead and mute yourself, and then I'm going to turn over to Ranjan. Hopefully Ranjan will be able to hear you. Can you unmute yourself and just do a quick test to see if we can hear you? Ranjan, unfortunately, we're having difficulty hearing you, and I'm not quite sure why. I am going to quickly.
Hello.
Yes, Ranjan, we can hear you. Great.
No. This is Zubair, and I'm just trying to. I'm just trying to relate that whether are you hearing me, and I don't know why
We
Ranjan
can, and
not
I
connecting. Okay.
wonder, Zobar, I wonder if you could maybe, what we'll do is we'll share, since Ranjan, we can't hear you, we'll share your presentation afterwards. But Zobar, since we can hear you, could you talk a little bit and maybe not talk through all of Ranjan's slides, but maybe you could share some of the experiences and the adaptation that you guys have had at national and local level. Would you be willing to do that? I'm putting you on the spot, Zobar, I'm sorry. But since we can hear you and we can't hear Ranjan, it would be great to just hear still the experience from Bangladesh.
Yeah, I can share something that's we have experienced so far. But as
Great.
I'm not prepared with the slides, or I don't know yet that how Ranjan have been prepared. But in a summary, I just would like to share with you, all of you, that this is really a very critical situation we are experiencing, and particularly as a country like Bangladesh with a huge population, and we have not very much preparation in the health sectors as well. And as you know that the CSO engagement was also not very active in the preparatory process.
Hello. Hello.
Great,
Hello.
Ranjan.
Yeah.
Zobar,
Sorry.
thank you for jumping in. And we'll continue. I'll give you an opportunity afterwards, Zobar, to add in anything. But if we could turn over to Ranjan to present, that would be great. So Ranjan, we'll turn to you, and Zobar, I'll come back to you when Ranjan is done to add anything that maybe he's missed. Thank you for your willingness to step up, Zobar. Ranjan, go ahead.
Yeah, there is some technical difficulty. Sorry for that. And thanks, Katrina, to check and remind me to check the settings. So, what is happening in Bangladesh? I want to start with this. Please, next slide. Evita, please go to next slide. Till today, there is total 12,031 positive cases, 51 deaths, and a total of 14,868 cases identified. And on 22 March, government declared public holiday, and it is continuing and will continue up to 25th April. If there is progress, it will be done, and if there is no problem, it is also continue like India is already declared up to 3rd. There is community level transmission already detected, and government mentioned this, and total at present 27 districts out of 64 is fully locked down. So this is the situation, and if you go to the map, mostly half of the country is under quarantine, and today there is 219 test positive and 5 died. So this is the scenario in Bangladesh, and from last 1 month, most of the international national organization is doing their business from home and through this type of webinar, Skype, and through this means. Next. So what we have started in case of Bangladesh, the Watershed as a national organization and international base in Bangladesh, we focused first almost on what is the hand washing practice, what will be the steps, and in this critical time, and what is the do's and don'ts in case of this COVID-19 situation. This we try to communicate within ourselves and sometimes in details with our staffs and with our partners, and we want to know what is going on in details. But in case of data availability, there is none. So we start with showing what will be the hand washing steps and disseminating the messages among our partners, among organizations within and beyond water aid and within and beyond watershed and its area. So next. So we launched in Bangladesh an emergency campaign titled Fight Corona United. And we try to coordinate with WHO and IEDCR. You know, IEDCR is Institute of Epidemiology, Disease Control and Research, who are actually the government mandated authority in case of this type of data, that is how many cases, how many death, how many tested, this type of government authenticated data. And they have their own website. They have under the Ministry of Health and Social Welfare number of guidelines, messages, and this. So we start with this type of messages and use social media, use our public media to transfer this. Be safe and keep yourself in home. Wash your hand. Throw your tissues in the basket. This type of messaging. So then, next. So, in case of watershed, what we have found and we are trying to adapt in this situation, as most of our work is stopped and we have no able to contact with our community, no able to organize any sorts of meetings, workshop and discussions. So, what to do? We start discussion internally within Water Aid, and there is two committee formed. One is Corona Action Committee, that is deal with the number of information messages and the situation, look after the situation, and control response response committee, COVID response committee, that is found. And based on this formation, we among the water aid and the, you know, the both are the watershed in country partner in Bangladesh, and we are implementing our program with directly support from CIMAV and also IRC and Wetlands Consortium member. The in-country partner, we started discussion what to do, what need to do, and we have our discussion with key actors like the Ministry of Health, the Ministry of Social Welfare, Ministry of local government, rural development and cooperatives, and also there is some national wash networks like Freshwater Action Network, Water Supply Sanitation Collaborative Council, SWA and others. So we in-depthly analyze the situation, crisis through secondary data, through WHO report, and then come up with what to do and what not to do. And we start with hand washing campaign and social distancing campaign among ourselves, both at national level and global. Then, with coordination support from CIMAV, then urgent call of Watershed Consortium organized, and it is held in the evening in this month. And in that meeting, we actually discussed on how we can adapt our plan. And Katrina's mail is one of the guiding point to discuss on the particular meeting. And alongside, in between, Alan and Evita also have an quarterly advocacy update call to see and review the status. So in this meeting, we found that under watershed we have 5 number of advocacy priorities, and we have set strategies, strategic goal, objective, and also the actors and factors to go forward and come up with. Most of these are under in the achievement, and some need to be pushed forward for this year for the greater achievement. So with this situation, what to do? So we focused on online actions like proper strategy finalization is one of our target advocacy agenda. So we started discussing with the concerned local government division, the National Working Committee meeting members for who are responsible for finalization of proper strategy, and we've seen it is happening because it is in the final stage, and it brings sometimes the message of government authority, the minister, it is come up. Next, please. So based on this, we adapted some of our actions plans, and we also involved with national level WASH cluster meeting, also UNICEF's need assessment working group to have some situation analysis work, and regular basis updating among ourselves what to do and how to do, mostly focusing on the hand washing campaign and social distancing message delivery. Next. So these are the actors in between we made and contacted. I will, here is the detailed list. I am not focusing here much, but who: UNICEF, Ministry of Health, IDCR, local government division, and the key WASH actors are our target during this period to adapt our strategies, and we build some strategic partnership and collaboration in case of addressing COVID campaign materials, messaging this way. Next. Next slide, please. So, based on national level message delivery, what we have done at Bhola, we involved the local CSOs at Bhola to discuss on. So, Water Management Citizens Committee and NGO network of Bhola Sador started taking action to aware people on protection and their recent action on pandemic corona. Then with support from DORP, the CSO engaged with government institutions and other bodies to ensure support the excluded group through message support and other support, not only focusing on the hand washing and health hygiene issue, but also on others issue like the relief targeted by the local government division and the government. This was the local CSOs also made and ensure coordination with local bodies so that the real poor people list can be supplied to the government authority. And CSO also involved in campaigning mobile SMS, then Union Parishad for messaging. Then they use local TV channel. Then they also deliver mask, hand washing devices at different level. So this is happening, and this is since the CSOs are seems more interested. They involve themselves to sometimes in delivering these messages, sometimes to coordinate with local government bodies, and this is actually going on. Next slide, please. Not only that, in between, in local government division at national level, there is a meeting with Minister of Local Government Division, where the local government division officials, Department of Public Health officials, mayors and chairmen joined, and they come up with the decision how to coordinate and how to involve the NGOs and local CSOs to deliver these messages. And also we made coordination with IDCRs for development of message and this type of things. So these two initiatives directly resulted one circular from Department of Public Health Engineering. It is focusing all over the country on how their staffs will be involved in COVID response in case of hand washing, message dissemination, development and demonstration of hand washing low cost devices, and also the messages. Next, please. Next slide, please. So at local, only one, the picture. Yes, yes. This is some of the local initiative that's DORP is helping involving the local CSO, that is Water Management Citizens Committee and NGO networking. One is miking, one is keeping social distance, how they can be safe, use mask and hand washing devices, and then use of local TV cable channel through which they are disseminating local level advocacy messages. Apart from this, the local CS is also helping and involved with local union porishad, Upojela porishad, for their relief work and identification of hardcore poor and the vulnerable people, the Bede community and the Rishi community, how they will get service from this pandemic situation, because this segment of people have no work, and due to their home quarantine situation, they need food from the government side or others. And some CSOs themselves are contributing in this relief fund. This is the situation now. So next slide, please. So overall, COVID-19 is now a reality, and it continues to spread. If we consider the overall increased trend, we are in a very dangerous situation in Bangladesh. Though from last 1 month we focusing on this situation, is trying to coordinate and do lobby and advocacy with national and local level authorities, how this will be addressed. And our project, within our project Watershed, our consortium member is agreed we will be flexible and will focus on more on addressing the reality of COVID-19. And mostly we are engaged in dissemination of hand washing messages, hand washing tools, techniques, using the local communication channels, and CSOs are involved here. And then the social distancing issue, whatever we are doing, maintaining social distance, but there is a lot of coordination, collaboration is going on within and beyond our network. Our CSO is involved here. So this is the challenging time for us, and we hope through adapting us in this way, we are able to reach with the poor family through our CSOs, and CSOs are actually doing a lot of things right now. And if we consider the uncertainty and changing reality, we need to adapt fast, and in some extent we are able to adapt ourselves and address some of things. So this is the quick reflection from ourselves in case of Bangladesh. Next. So this is the quick reflection of myself in Bangladesh, and I want to thank local partner DORP, IRC, Wetland International, and even AGBO and SIMAVI, because in this crisis situation they have given us the freedom to make us flexible. Using this flexibility, we actually finding out the OS and try to collaborate and link ourselves in this situation. So, Alan, this is from my side.
Yeah, great. Thank you so much, Ranjan. So there's been really great discussion and a lot of questions happening in the chat, which is wonderful. I'm going to start with a couple of the questions that have been highlighted, but if there are people who are interested in sharing or responding to some of the questions, please just like type in the chat box hand raised or something like that, so I know to call on you. But I'm going to start with a couple of questions, and these are for Patrick and Ranjan. For Patrick, to start off, there were a lot of questions around the technology, around using Zoom, and whether or not that's how effective that is to reach the whole population that you're trying to reach, whether or not that's leaving people out, questions about kind of the effectiveness of using that. And to add on, there were suggestions and questions around potentially using SMS. And that seems to be happening. There was an example, I think, presented by one of your colleagues around that. But if you could just talk a little bit about how you've done or how you plan to use Zoom with the citizens, Patrick, that would be really great. So if you want to unmute yourself and go ahead and we'll start with that question.
Okay, thank you, Helen. I've also seen the question coming from Jimena. Yes, we've been able to use Zoom a number of times, and personally, I haven't come through an incidence of crashes or hacking and people taking away our information. But I've been informed by one of our colleagues, Wetlands International, and other friends that there's that kind of a threat that people using Zoom can be exposed to. Of course, we are going to relook at that. How we plan to use Zoom to engage citizens. Yes, when you talk about involving everybody, you might end up losing some people. But our design was that we look at the different citizen groups where we are going to start in Laikipia or Kajiado, and we try to select one person or a number of them, those who have smartphones and those who can be able to use a smartphone to talk. We avail airtime to them so that they are able to connect with us, and through them they be able to provide the information that could be affecting that particular kind of a group. And we are looking at the people with disabilities, the youth, people living in the slums, different stakeholders, like people like the Water Resource Users Associations, who are now doing a lot of water allocation issues. So we plan to look at those particular groups, and then we pick one or two who have a smartphone and who can be able to speak on behalf of the rest. Otherwise, using everybody, you may not be able to manage that. And the Watershed will be able to avail support through airtime, availing airtime to them so that you can be able to engage. Last week, for example, we had, when we were having a high-level discussion with the county government, Department of Public Health, and some CSOs, one of the vulnerable representatives joined us, surprisingly. This is the famous Valentine Mobafi from Laikipia, the disabled lady. And she was very okay. She could be able to use her smartphone. She was able actually to do video call. And she was able to give us the issues affecting people with disabilities within the slum areas. And we've been able to capture the issues that are affecting them, and we know we can be able to raise them up. So the point is inclusivity. We are going to be selective on all the groups being involved, but we pick a few to represent their views. Otherwise, that's the much we could be able to do with this online technology.
Great. Thanks so much, Patrick. And I think that's a really interesting point, that sometimes and we often, that's a tactic that's used in advocacy in general, and it brings up all kinds of additional questions that we won't talk about now, but around kind of legitimacy, and is that something that can be established in a non-pandemic and a non-crisis setting, so that when it comes time to get responses or share information or to ensure that there's proper representation, that there is the legitimacy of these different entities to kind of represent the voices of communities and of the marginalized. So thank you, Patrick. That's really helpful. There was an interesting question from Irma that was talking about messaging post-pandemic. And what are some of the ways, or what, opinions? This can be answers from anyone, or particularly from Ranjan or Patrick, about when is the right time to introduce post kind of pandemic, like ongoing, more sustainability types of messaging versus just with a focus on kind of the immediate crisis. So does anyone have ideas or thoughts on that they wanted to share? Patrick or Ranjan, we'll start with you. Do either of you want to jump in?
Ellen, I can start with. If
Yeah,
you
please go ahead,
go
Ranjan.
through Watershed Bangladesh experience, what we have done, we start with actually hand washing messages. Then gradually it comes. We started with hand washing messages, how it will be happen, and even we organized courtyard meeting in the very beginning. In the last month, okay, then gradually the situation become changed, then social distancing message become more vibrant. In our experience, we seen whenever the people coming from outside country with the issue of pandemic virus situation, they kept to the home quarantine or institutional quarantine. In case of home quarantine, we found they are not maintaining the home quarantine situation, and this has getting expand to other households and other people. So considering there's government stick with not to go outside the home, and they lock down the district, lock down the area, even in a village. This is happening in case of Bangladesh. So our message become changed, and it is now, please keep your distance at least 3 feet in line with WHO guideline. So this is happening. So based on the situation, based on the effect of this pandemic, the message will be depend, and it is actually what government is saying. If you go to our mobile phone, if you call someone, you will find the ringtone message, please keep your safe distance, stay safe, stay home. This type of message, that is government is doing that. At local level, we also use the mobile messaging, and our staffs at Bhola, they throughout the CSO member, they send this type of messages. And I see in the message box someone say everyone have no mobile, so how everyone will get these messages. So considering this aspect, we also introduce miking, and with coordination with the local union porishad, DORP, and local CSO already shared some messages, and union porishad, ensuring the social distancing aspect, started miking up these messages so that everyone get these messages. Even in the Bede community state in the nearby river. So through this way, we try to ensure that this message go to the people, and they practice it. So this is happening.
Great, thank you so much. So Ranjan, if you want to mute yourself, and then so Samson, if you are there, if you want to unmute yourself, and I'm assuming. Yes, I think it's Samson. Maybe not.
No, I am just would like to add something with.
Yes, yeah. Zobar, go ahead. Yep.
Yeah, thank you very much. Yeah, I think the situation what we are experiencing is really new, and we don't know how to progress, because every day we are learning different things, and we are experiencing a lot of new information, like that's in Bangladesh there are a lot of population, those who are living in slums, as well as the squatters, as well as the different small houses, but they had to based on their daily labor, daily works. They cannot go out. This is the 30 days now we are passing as a so-called lockdown or whatever. Government is really strongly taking care of this lockdown, that no one can go out, and particularly these vulnerable community, particularly this marginalized, are really in trouble of their daily life, daily livelihoods, because they are not worried about the corona or this pandemic. They're saying that we don't have food. Every day we have to go out and work. Then otherwise we cannot get food. So in this situation, twofold. We are talking about the awareness building, social distancing, and also hand washing. But at the same time, still it is not reaching to the marginalized groups in relation to their other priorities. So this is really a very important issue to consider. And secondly, these days we are trying to reach them innovatively, because as Ranjanda was mentioning, that we started to create how hand washing can be more effective. We use the loudspeaker, etc., etc. But still, every day we are thinking for new innovations so that all can keep in their home, and they can be safe and secure, at least in coming lockdown situation by the government. Thank you.
Great, thanks, Ranjan. Sorry, Zobar. Samson, are you there?
Yes, I'm here. Can you hear me?
Yes, we can hear you. So please go ahead. Maybe you can just quickly say who you are. I forgot to mention, but Zobar, we know that you are part of Watershed in Bangladesh. So Samson, could you just quickly introduce yourself, and then if you could share about the post, about Irma's question about kind of messaging post-pandemic and when to introduce that, that would be great.
Sure. Good afternoon, everyone, and thank you for this very interesting discussion. My name is Malesi Shivaji. I work with KewasNet and part of Watershed Kenya Work Package 2. Now, I just wanted to quickly share my perspectives around the issue of the post-pandemic messaging and some of the key things to focus on for our advocacy. But I'd like to say that when we think about the post-pandemic issues, we must already highlight what they are right now during the pandemic, so that we are able to objectively position them right now and include them as part of the agenda and current discussion. And I'll just give examples. Right now, there is many of the development partners are making humanitarian response in response to the COVID-19. Most of these organizations, including government agencies and departments, have traditionally not been structured to do that. And therefore, one of the biggest challenges that we are foreseeing is the issue of accountability, on really accounting for where is the investment going right now. Is it going to the right priority? Is it, are they able to account for it after the fact? So one of the key things that we already want to start messaging right now with a very post-pandemic perspective is the issue of accountability for the investment, especially in the WASH sector, towards managing the pandemic. But to do this, I think one of the key things, and I think Ayan has severally asked within the chat on the issue of data. It is really important that even for messaging around various issues, that we are already very clear on monitoring the situation and collecting data on very specific things that we want to message upon. But this also raises a question, because one of the things we are finding in Kenya is that there are also things which are unfolding, which we thought, or in the initial perspective, are not really part of the primary challenge, but secondary issues are coming up. And I've mentioned something like gender-based violence and issues of sanitation crisis also arising. So even as we define what data we want for our effective post-pandemic messaging, it will be very important also to be flexible to update our tools so that it is the tools are able to capture new data as the situation unfolds and new key issues come up within especially the marginalized and people most at risk. I think the other thing that we would also want to look at very keenly in the post-pandemic era is on whether there are any reversal of gains made pre-pandemic. And this would be in various areas, either in the entire space of policy advancement, issues of investment financing for the sector, now that budgets are being shifted to address the crisis, but also the structural arrangements that we had put in place to enforce our advocacy. So we need to look at some very clear messaging around that, because one of the key things is that with shifts focusing on the pandemic, it might be there might be a very big excuse of the pandemic or on the part of the responsibility of the duty bearer. And finally, I think one very important issue that I will look at the Kenyan example specifically. So government has come clearly and said the water service providers, for example, should suspend disconnection of water supply. They should not disconnect for people who are not able to pay. The power company should not disconnect power. But the meters are still running and there are bills which are still accumulating nonetheless. So how are these going to be managed by government and by service providers? Because we foresee then that there's going to be a situation where as much as there is an effort to ensure sustained supply during this crisis, after the pandemic, there could likely be a lot of disconnection and therefore the suppression of the rights to water and sanitation. So I will stop there. Those are just a few examples.
Thank you so much. You raise a lot of really good points and approaches, but also and messaging, I think. And I would just echo that, now is the time to be thinking about what are those messages for the long term and taking that into account. So I think really good points. So thank you very much, Melissa. I appreciate your comments there. I want to provide, there's a lot of really good questions and discussions happening in the chat. And we're not necessarily going to get to all of them. We have about 15 more minutes. I saw some folks from the Ghana team are online, and I also saw that at one point Arnold was online from IRC in Burkina, and I was just wondering if either someone from the Uganda team, from the Ghana team. There's also folks from the Uganda team I saw also, but anyone from the Ghana Watershed team, or if Arnold, if you wanted to talk about some of the approaches that you're taking. There's some questions or ideas, and I think we've covered a lot of that in the presentation posted right now about adapting messaging, about reaching populations. One of the things that we haven't talked about, which I think people are addressing, is in the idea of social distancing, how do you reach some of the targets? Not necessarily the recipients of your messaging, but reaching those high-level targets that you had for your advocacy. And I know that that's been happening in Kenya through a variety of briefs and other things through policy. But I was just wondering if anyone, is there anyone, just kind of give me a heads up if anyone from the Ghana team or Arnold, if you wanted to talk about the work that you're doing in Burkina. Yes, Veronica, please, your hand is up. So if you just want to unmute yourself and talk. Yeah, please go ahead. Thanks.
Okay. So I think we're quite a few on the program, on the line right now. So I'll just tell you from Accra. From Accra, because we're home, we're actually having to work from the house. And so we don't have, the government is playing the central role of trying to coordinate all the efforts. And in the process, it's very difficult for civil society to find a space in the process. The Ministry of Health has been working with the information. This year is an election year, so it's a bit tricky on how these things are going. But as the cases are unfolding, we're finding that we all need to have a role in it. And it's quite difficult, especially if you are in the restricted area, to know what your role is, because we're not part of the exempt staff. So we have to be at home. What we have been doing is to make sure that we're getting in touch with our partners who are not in the restricted areas. What we've also been doing is to try to see if we can use radio, if we can get some of our conversations around on the webinar. And we're already having these discussions. Basilia is on, and she can tell you what CONEWAS has also been doing going forward. But it's been a bit restricted because then you can't really move out, and there's not, it's not an open forum to discuss, if you get what I mean. So it's a bit of the decision making is centralized, and CSOs have not been fully given some space in it. At the district level in Takwa, it's not under restriction yet, so Mercy is online and she can also tell you a little more. I just want to stop talking quickly so that, Basilia, if you can hear me, come on now.
Okay, thank you very much, Vero. Like Vero said, it's been a bit difficult working. Most of our engagement has to do with government agencies through dialogues, meetings, and through media engagements. And so for now, what we have done currently on the part of the media is to do press releases. We were able to issue a press release to celebrate the World Water Day, and then not only sharing messages on COVID, like linking it to COVID, but also trying to find out how we can protect our water resources with climate change, looking at the theme for the World Water Day. And in Ghana, I don't know if it was already mentioned, luckily the government is going to take up free water. So the government will pay for the bills of people. And so what we are also writing out again to advocate on this is the need to ensure the sustainability of the water even after the COVID, because we have recognized that there were so many places without access to water already. And maybe some of them are still using very bad sources and the continuous dumping at our watersheds. So we are making government to recognize this and to ensure that even after the pandemic, they try to ensure that there is sustainability of the water service they're trying to provide now to most communities or areas who do not have the water sources now. And then we are also linking it again to the fact that if we need sustainability of the water service, we need to also address the galamsey issues that still exist in the country. And as Vero said, most of our meetings are online, and currently we are trying to discuss with the Ghana Water Journalists Association to see how we can bring on board some few stakeholders in the water sector, like the WRC, to hold an online webinar and invite our members to join, so that we can discuss based on some of the already existing examples we have. And like Vero mentioned, HFFG is still working because they are not under lockdown, so we can share experiences from the communities who are still working, and then look at how we can use the examples or the lessons from there to address national level issues. So we are still trying to target which national level players we will get on board on this dialogue. Thank you.
Thank you so much, Basilia.
Ellen, can I just let Mercy round up and then we're done?
Yes, that's fine. Mercy, are you there? Mercy, we can't quite hear you.
Okay, if she's not, then we move.
Yeah, so if she's there, if we can hear you,
unmute yourself.
Mercy, maybe you can type what you've been doing in the chat box, that would be great. Arnaud, so thank you so much, Vero and Basilia and Mercy. There's a lot of great things, I think, that are happening across all of the watershed countries. So thank you for sharing the experience from Ghana. Arnaud, can we turn to you now to talk a little bit about what you've been doing, kind of shifting a bit towards really national level kind of policy and engagement, which has also been happening, I know, in many other countries. Arnaud, can we turn over to you? If you can unmute yourself and share the experience from Burkina.
Hello, everybody. Do you hear me?
Yes, we can. Thank you so much.
Okay, good. Our experience is an opportunity to pay attention to the governmental measure, social measure, to support the population. As you know, a lot of people who are not salaries are limited in their movement, and during this crisis, the government put in place some support to people. So it's an advocacy for the inclusion of rural populations in the government social measure to support access to drinking water during the COVID crisis. The first positive cases in Burkina appeared on 9th of March. And there was a big interest for hand washing devices, but water is needed, and everybody doesn't have access easily to the water. So on the 2nd of April, there was an address to the nation of the president of Burkina Faso. And between the social measure, it's told that urban population can get free access to water from 1 to 8 cubic meters per month. And this will be supported by the government. And this measure don't include rural population. And when we saw that, we initiate an advocacy direction to the ministry and the professional of the water sector to make that they can take in account also rural population. So I want to also to recall back that Burkina Faso has recognized in its constitution the rights to water and sanitation. And also these rights are recognized in some, are integrated in some strategic documents in the water sector. But there is a big gap between this and what is really implemented. For example, we don't have any operational mechanism to take in account equity concerning the water tariff in rural area. Therefore, rural people pay water more expensive than urban people. So it's in this context has initiated this advocacy. The first action is to appeal to the professionals and indirectly also to the Ministry of Water on the WhatsApp forum we have for the professional in Burkina here called Le Pro du Wash. So to ask the people why really the rural population are not taken in account. And we also worked with some journalists to write some articles which have been published during last week, and appeal also the ministry and the president concerning the exclusion of rural people. So this article has been relayed on in other media on the online. We stimulate also to share his analysis with other media like television and radio, also national radio, which are going now to appeal the government on this exclusion. That is in few words what we are trying to do here. I will also add that it's a little difficult to organize some meeting of the WASH Civil Society Organization Task Force at this moment. You have also to react very quickly. If not, people can pass on this and they will read any response in the future. So that's what I can say very quickly about the advocacy we are doing. And this allows us to say that we can also pay attention to the social measure the governments are putting in place presently to face this crisis, and to analyze this, to see if there is no exclusion, if people are not left behind concerning measure in the water sector. Thank you very much.
Great, Arnold, thank you so much. So, so we have about 2 minutes left. I know that there's a lot of great discussion that's been happening in the chat box, and this could go on for a lot longer, but I know everyone has things that they need to be doing, and it's starting to get late in certain places. So I just wanted to go over a couple of highlights that I heard and things that are food for thought. And I also put in the chat box, if there is interest in additional webinars to cover some of the content that we didn't get a chance to talk about or to delve further, please let us know and write in the chat box any particular topics that you might like to have. And if you have interest in joining kind of a future webinar with additional cases or even just to continue the discussion that we're having. So a couple of things that I wanted to highlight before we finish. One of them is around messaging. There was a lot of varieties of tools that people are using to deliver messages, variety of technology, radio, SMS, Zoom, using social media, Skype, WhatsApp, to get the messages across. And I think a lot of that is based in some of the relationships, especially when looking at how to reach your targets, is the relationships that have already been in existence and having access to folks via, example, WhatsApp or other telephone calls or other ways to get in touch with those that you're targeting, but also messaging in some of the creative ways that messaging to reach the most marginalized, which is a really big challenge that came up. The other thing is that to talk about what Arnaud and others mentioned, that we don't want to miss any opportunities. And so we've heard a lot about flexibility and ability to react quickly. And I think that that's really key, especially being able to adapt your messaging extremely quickly in a hasty manner, because decisions are being made extremely quickly. And so the ability to react quickly and to get buy-in from civil society or other partners is really important. And the last thing that I just wanted to touch on was around planning and adaptation. There's been a lot of discussions, a lot of these discussions and examples that came from Bangladesh and Kenya about how they had a strategic way of going about adapting and talking about how they would adapt things like messaging or approaches or the targets or how the activities that they might be able to do. And so just as you would plan for anything else, it's important to think about in this time, how do you not only plan but adapt? So on that note, there's a lot of other things that I could talk about, but I think there's a lot of learning that's happened on this webinar. And I just wanted to thank all of our presenters, Evita, Ranjan, and Patrick, for their contributions, and all of those who joined online for the great conversations in the chat. We'll leave the chat open for another couple of minutes for anyone who wants to add anything. But if you have any specific ideas or topics that you'd like to cover potentially on future webinars related to adapting to the pandemic, or adapting your advocacy to the pandemic, please let us know. So everybody, please stay safe and stay healthy and continue to do all of the great work that you have going on. So thank you so much for joining, and we look forward to continuing the conversation in the future. Thanks again. Oh, just one final note, we will be sharing with everybody the presentation as well as some of the concepts and maybe outstanding questions that came from the chat. So we'll try to have that up and out as soon as possible, but we really appreciate all of the feedback and all of the conversations that happened today. So really great, and we look forward to hopefully engaging again in the future. Thanks again.
Thank you.